The scalpel's tip hovered, catching the morgue's cold fluorescent glare. I remember the hum of the ventilation, the chemical sting of formalin, the metallic chill of steel on stainless. To everyone in that room, the patient was dead. The toe tag said so, the monitor said so, the silence said so, and yet something in the stillness felt wrong, almost watchful. We'd finished the external notes: pallor, lividity, time of death confirmed. A faint echo of distant footsteps tapped through the tiled corridor, like a slow metronome counting the minutes since life had supposedly left. I leaned closer, studying the eyelids. They seemed too soft, too recently warm. A harmless illusion, I told myself. But the doubt kept breathing in my ear. The body's chest looked slack, the kind of heavy quiet that horrifies new interns. We rehearsed our checklist like a ritual. ID, consent, instruments, incision lines. Deadly certainty makes the hand steady. Certainty is currency here. Yet a subtle twitch of light across the cornea snagged me, a trick of angles or a ripple of air. The others didn't notice. My pulse did. At the first shallow contact of steel, a sound cut through the room, a whisper of breath, soft, unbelieved. I froze. The assistant laughed it off, nervous, denying the impossible. The ECG cart was unplugged, the stethoscope cold. I bent low, closer than protocol. Was that warmth on the lips or the morgue's damp air? The answer refused to be quiet. A single eyelash quivered. Then the eyelids fluttered, slow, staggering, alive. Someone gasped, someone swore, someone prayed. The toe tag swung like a clock, as if counting backward. Our certainty broke first. The patient's eyes opened second, and what happened next would challenge everything medicine thought it knew. I wasn't supposed to question the obvious. The chart documented cardiac arrest, failed resuscitation, time of death signed. The body was transferred to pathology for a routine post-mortem. But our routine was about to fracture. The angle of this case is simple to say and hard to believe. A patient awakening during a post-mortem exam, conscious where consciousness had no permission. He was middle-aged, ordinary on paper, extraordinary in fate. No celebrity, no miracle drug, just a man whose final minutes stretched beyond medicine's grip. In the morgue's chill, his story bends from science to shock, from dead to something that looked like survival. The question is not only how he woke, but when we should have known. The setting matters. Tiled walls, antiseptic air, lumens of unforgiving light. The team was small, attending pathologist, assistant, me. We weren't hunting a twist. We were hunting clarity. Yet clarity can be deadly when it blinds. When silence sits too long on the chest, you stop expecting the chest to talk back. That expectation almost cost him everything. Here's the medical curiosity tied to extreme survival. Rare documented events like autoresuscitation, sometimes called the Lazarus phenomenon, occur after failed CPR, with circulation returning unexpectedly. Less known are borderline states where faint respiration or residual brainstem activity masquerade as death. They're uncommon, controversial, and terrifying when discovered under surgical light. This case would push those boundaries to their edge. We'll follow the trail from first signs to a shocking reversal, balancing emotion and explanation. What the family felt, what the monitors missed, what the body tried to say in the quiet. Before we dive deeper into this shocking case, make sure to subscribe, hit like and comment what city and country you're watching from, so you never miss the next shocking story. The room was ready for certainty. He was ready for air. It began days before the morgue's chill. The patient, Mr. Alvarez, a 47-year-old factory worker, complained of sudden chest heaviness while stacking boxes. His colleagues thought it was exhaustion, maybe dehydration, but the pain didn't fade. Instead, it spread. Up his jaw, down his left arm, classic deadly signs ignored in the rush of daily life. He brushed it off, unaware the clock on his survival had already started ticking. That night, his wife described him as pale, restless, drenched in sweat. He waved her worry away with trembling hands, whispering, "It's nothing." The house smelled faintly of fried onions from dinner, but beneath it lingered the sterile scent of the nitroglycerin tablets he kept unopened in the drawer, left over from a previous hospital visit. He promised he'd take one later. Later almost never came. By dawn, his breathing had turned shallow, rattling against silence. His son dialed emergency services, voice shaking. Paramedics arrived, their radios crackling, their boots echoing across the hallway. They found him collapsed, pulse thready. A monitor screamed arrhythmia. The diagnosis was blunt: acute myocardial infarction, a heart attack so severe it risked tearing the very muscle that pumped life. He was rushed into the ER. Fluorescent lights flickered above as doctors swarmed, barking doses, aspirin, oxygen, IV lines. His veins resisted. His heart resisted more. The rhythm on the screen danced from deadly fibrillation to flat silence. Shocks of electricity jolted his chest, making his body leap like a puppet. Each shock carried hope. Each silence carried despair. I remember the intern's voice. "We're losing him." The attending counted aloud. Compressions, breaths, compressions. His ribs groaned under pressure. A faint gasp escaped, then disappeared. For a moment his skin flushed pink, but the pink drained as quickly as it came. They pushed adrenaline, desperate to summon a miracle. The miracle seemed late. After 40 minutes of relentless effort, the room grew heavy with fatigue. The attending checked the pupils, fixed, dilated. No corneal response. The stethoscope delivered only silence. "Time of death, 7:43 a.m., she announced. The words stamped finality into the air. Family members cried outside the curtain, unaware that death certificates sometimes tell only half a story. His body was prepared, tagged, and transferred. The morgue technicians joked quietly to mask unease, but the truth lingered. His face still seemed soft, not yet surrendered to rigor mortis. His wife whispered goodbye through tears, clutching his hand one last time. It felt warm. She thought it was her imagination. Warmth doesn't belong to the dead, or does it? Later that afternoon, the decision was made to perform a post-mortem examination. The case wasn't routine anymore. The hospital wanted clarity. Why had a relatively young man collapsed so suddenly? Were there hidden pathologies? Aneurysm, myocarditis, electrical disorder? Answers were needed for science, for family, for closure. The autopsy room became his next stage. On the table lay not just a body, but a mystery. The team prepared instruments, aligning scalpels and forceps like weapons of certainty. They didn't know that one clue had already whispered through the chaos. Faint, almost invisible chest movement minutes after resuscitation ended. It had gone unnoticed, buried under exhaustion and protocol. That oversight would soon ignite the most horrifying twist of their careers. Doctors thought the story had ended at 7:43 a.m., but Alvarez's body disagreed. The truth of what happened in the autopsy room would make them question not only the diagnosis, but death itself. In the ER, Alvarez's decline wasn't linear. It was a storm. His heart fought with violent irregularity, switching between desperate bursts and deadly silence. Every monitor beep carried tension. Nurses whispered in clipped tones, the smell of antiseptic mixed with sweat and fear. The family clung to fragments of hope, waiting outside a door that swallowed every answer. The complications piled fast. Pulmonary edema set in, his lungs filling with fluid like a drowning from the inside. Each breath gurgled faintly, bubbles of air trapped in a sea that shouldn't be there. Oxygen masks hissed, ventilators strained, yet his chest rose weaker each time. Doctors exchanged quick, horrified glances. Signs of circulation were slipping away. Blood pressure dropped to numbers that made even the experienced staff blanch. IV fluids poured in like water into a broken vase, leaking faster than the body could hold. Vasopressors were added, drugs meant to squeeze blood vessels and force pressure upward. but his heart remained stubborn, rebellious, refusing the chemical orders of science. A sudden seizure ripped through his frame, twisting arms and legs violently. The crash cartwheels screeched across the floor. Electrodes were reapplied. Monitors screamed ventricular fibrillation, the most chaotic of heart rhythms. "Clear!" The shock hit again. His body arched against the table, then collapsed back with a thud that echoed finality. For a moment, no one breathed. A systole appeared, the flat red line. Silence stretched like eternity. The attending muttered, "We've done everything." Still, compressions continued, the sound of ribs creaking with each desperate push. A junior doctor begged for one more dose, one more try. But exhaustion is a thief. It steals precision, steals faith. After 40 minutes, the pronouncement was made. Alvarez was declared gone, yet small irregularities remained. His skin stayed faintly pink, not the usual pallor of death. Capillary refill, when you press the nail bed, still flickered sluggishly, though overlooked. The team rationalized, maybe residual circulation, maybe nothing. Medicine demands certainty, but certainty sometimes blinds. Those overlooked signs were whispers of life, muffled under layers of protocol. His wife was allowed in briefly, trembling. She kissed his forehead, murmuring, "Please wake up." No one told her that warmth can linger from cellular metabolism. No one dared admit uncertainty. To her, it felt like hope. To the staff, it was dismissed as grief's illusion. The stretcher rolled away, leaving her sobbing in the hallway. In the morgue, the atmosphere was colder, quieter, yet even here, small details unsettled the technicians. His chest seemed too pliant, as if not yet stiffened by rigor mortis. His eyelids twitched once when adjusted, but they shrugged it off. Post-mortem reflexes, they said. Experience told them dead bodies sometimes mimic the living. But this time, experience was wrong. Hours passed, and paperwork finalized the narrative of death. The chart carried signatures, timestamps, and certainty, but behind that certainty hid a paradox. A man categorized as gone, while his body whispered otherwise. Invisible circulation, microscopic breaths, faint neuronal sparks. They were there waiting to be noticed. Medicine missed them. Fate did not. The autopsy was scheduled. Instruments gleamed under fluorescent lights. The staff prepared, unaware that the corpse would soon interrupt its own examination. They thought they had seen every complication a heart attack could bring. They were wrong. What Alvarez's body was about to do would horrify them all. The autopsy room was sterile, humming faintly with fluorescent lights. Instruments lay arranged like soldiers on parade, scalpels, forceps, bone saws. The air carried that unmistakable cocktail of disinfectant and cold steel. Everyone assumed Alvarez's story had closed at 7:43 a.m., but when certainty becomes routine, it blinds even the sharpest eyes. That blindness was about to shatter. The pathologist dictated notes, voice echoing against tile. Male, 47 years, cardiac arrest. The assistant marked incision sites, gloves squeaking on pale skin. I leaned close, double-checking the checklist. That's when I noticed it. A faint fog on the metal tray, as if the air above his mouth trembled. Could it be breath? My mind screamed impossible. Still, my hand trembled. A subtle flicker ran through his eyelid. The assistant froze, then chuckled nervously. Nerves. Post-mortem reflexes. We'd all seen it. Random twitches after death. But this was different. It lingered, deliberate, like the body wanted to send a message. I bent lower. That's when I heard it. The gentlest hiss, unmistakably air-passing vocal cords. A whisper of life. "Check vitals," I shouted. The ECG was unplugged, the monitors cold. A stethoscope pressed against his chest revealed something faint, like a distant drum muffled by walls. Not a full heartbeat, but a sluggish thud every few seconds. My skin crawled. This wasn't a corpse. This was suspended life, misjudged, mislabeled, misunderstood. Chaos erupted. The assistant backed away, eyes wide, nearly dropping instruments. He's alive? The word felt forbidden here, almost profane. A rush of adrenaline filled the room. I clamped his wrist, searching for a pulse. There it was, weak, irregular, but real. Certainty dissolved into terror. The patient had crossed back, dragging us into the impossible. Scientifically, it had a name: autoresuscitation, the Lazarus phenomenon. Rare cases where circulation spontaneously returns after failed resuscitation. Most reports describe seconds or minutes of delay, not hours. Alvarez had pushed the limits of biology, challenging the boundary between death and survival. Was it physiology? Was it fate? No one could say with confidence. The pathologist's hand shook. We need to move him now. But protocol stood like a wall. Legally, Alvarez had been declared dead. Paperwork, signatures, certificates, all stamped finality. To undo that meant admitting failure, admitting error. Yet leaving him here meant slicing open a living man. The decision carved through the room sharper than any scalpel. Suddenly, Alvarez's lips parted. A faint groan escaped, low, guttural, human. Every hair on my arm stood upright. The room froze. He wasn't just alive, he was conscious. His eyelids fluttered wider, revealing pupils that tracked faintly in the light. He was trapped between two worlds, one of silence and one of screams. We scrambled. Oxygen mask slapped onto his face, IV lines rethreaded, defibrillator wheeled back. The morgue turned into an emergency ward in seconds. The assistant muttered prayers under his breath. I whispered, "Stay with us, Alvarez. Don't leave twice." His chest struggled, half rising, half collapsing, against every expectation he was fighting back. Yet questions clawed at our minds. How much brain damage had the minutes or hours without oxygen caused? What price had survival demanded? We didn't know. What we did know was this: a man pronounced dead had just forced us to confront the fragility of our certainty. And the most terrifying choice still lay ahead. How far would we go to keep him alive? The morgue transformed into an emergency theater. Technicians abandoned their routines. Doctors rushed back with carts meant for the living, not the dead. Alvarez's chest rose unevenly, struggling to claim each breath. His eyes, half-lidded, seemed to plead without words. "Don't let me go again!" The weight of responsibility pressed down heavier than the steel scalpel still glinting on the tray. Protocol screamed in one direction: stop. Legally, Alvarez was dead. To reverse that would mean confronting documents signed, families informed, procedures initiated. The attending pathologist hesitated, muttering, "If we resuscitate, we'll face questions we can't answer. But hesitation in medicine can kill." I whispered, "If we do nothing, he will die." Again, silence cut sharper than the instruments. The decision broke like glass. "Restart full code," the senior doctor commanded. Nurses sprinted. Oxygen hissed into Alvarez's lungs. AV lines pushed fluids like rivers against drought. Epinephrine surged through his veins, forcing vessels to constrict, blood to move. His heart stuttered, coughed, then jolted with faint rhythm. The ECG, reconnected, trembled with erratic spikes, life fragile and defiant. Still, complications loomed. Hours without clear oxygen risked catastrophic brain injury. Could his consciousness survive? We debated hypothermia treatment, cooling his body to preserve neurons, a controversial but promising therapy. But in the morgue, with limited equipment, we improvised. Bags of ice from storage were wrapped around him, transforming cold death into a tool for survival. His wife was summoned. She stumbled into the room, eyes wide with terror at the sight of her husband breathing beneath autopsy lights. "He's alive?" she gasped. "He's alive," the doctor confirmed, though the word felt fragile. She clutched his hand, repeating his name like a mantra, tears dripping onto skin that should have been unresponsive. But his fingers twitched back. Science collided with miracle. The medical team debated transferring him immediately to ICU. Risks: cardiac arrest en route, collapse of airway, loss of what little rhythm he had. Risks if they waited, brain swelling, multi-organ failure. Each second screamed urgency. Finally, the critical decision: move him now. The gurney wheels shrieked against the corridor tiles, carrying the dead man back into the world of the living. In ICU, advanced interventions awaited. A ventilator claimed his breathing. Cooling blankets wrapped him. Medications dripped steadily, balancing electrolytes, stabilizing pressure. Monitors painted a fragile picture, unstable but present. "He shouldn't be here," a nurse whispered. "And yet he is," I replied. The room carried awe, fear, and a sense that science was standing on holy ground. Hours crawled like days. Every spike on the monitor became a prayer. Alvarez's brain activity was assessed. Sluggish waves, but waves nonetheless. Pupils responded faintly to light. Doctors exchanged cautious glances. There was hope. His wife refused to leave, whispering, "Come back to me," as machines hissed around her. Every whisper was a lifeline tethering him to reality. Behind the science lingered haunting questions. How many others, misdiagnosed, had been silenced forever? Was Alvarez an anomaly or a warning? The morgue had nearly claimed him twice, once by his failing heart and once by human certainty. That realization sat heavier than any medical text, echoing through every professional in the room. By dawn, his condition stabilized slightly. The impossible had been postponed, if not reversed. But no one knew what tomorrow would bring. Recovery, brain damage, or collapse. All we knew was this: against death's script, Alvarez had improvised his own line. And the final act of this story was about to begin. Days blurred into nights in the ICU. Alvarez lay suspended between silence and awakening, his body cocooned in wires and monitors. Machines hissed, screens flickered, alarms chirped in sudden bursts. To many, he looked like a man tethered artificially to life. But to those who had seen him open his eyes on the autopsy table, every flicker of breath felt like defiance. His wife never left. She read old love letters aloud, hoping sound might pierce the fog of coma. She placed their son's toy car on the nightstand, a symbol of the life waiting beyond these walls. Nurses smiled softly at her persistence. Science offered percentages and charts. She offered faith and memory. Between the two, Alvarez floated. Then the first sign, a twitch of fingers, subtle yet deliberate. "He moved," she whispered. Staff checked reflexes, skeptical, but when she asked him to squeeze her hand, his grip answered, weak, trembling, but unmistakable. Hope surged through the room like electricity. Machines recorded data, hearts recorded miracles. Slowly, fragments of consciousness returned. At first, he followed voices with sluggish eye movements. Later, he whispered faint words, disjointed but coherent. "Where am I?" The answer was impossible to simplify. Between death and life, between morgue and recovery, doctors settled for the short truth. "You survived." He blinked, processing the weight of those two words. Rehabilitation began. Muscles stiff from immobility resisted. Speech slurred. Memory staggered. Yet every attempt, every struggle, was proof of survival. Physical therapists guided him, step by step. At first, he collapsed after 2 paces. Weeks later, he managed to cross the hallway, IV poles rattling beside him like clumsy companions. Each step carried the echo of an impossible journey. Doctors analyzed his case with fascination. Autoresuscitation, rare enough in minutes, nearly unheard of after hours. Journals had documented it sparsely, often dismissed as anecdote. Alvarez wasn't just another patient. He was a living challenge to medical certainty. "We declared him dead," one physician admitted, voice heavy. And yet, he chose not to stay dead. Emotion rippled beyond the hospital. Other patients in the ward whispered his story, calling him the man who came back. Families of the critically ill found comfort. If he could return, perhaps their loved ones could too. Nurses found renewed purpose. Even the pathologist who prepared for his autopsy confessed sleepless nights, replaying the moment his eyelids moved. But Alvarez himself carried the heaviest weight. He described dreams of being trapped in a tunnel of muffled voices, unable to scream, unable to breathe, until a sudden light pulled him back. Whether brain phenomenon or spiritual encounter, he couldn't say. All he knew was the moment he felt his wife's hand in his and realized he wasn't gone yet. Months later, he stood outside the hospital, frailer than before, but alive. Cameras captured his smile, the scar of a chest incision visible beneath his shirt collar. He told reporters, "I woke up when they thought I was gone. Life doesn't give second chances often. I got mine." His words echoed far beyond medicine. They became testament, warning, and miracle combined. His case reshaped local protocols. Hospitals reinforced extended monitoring after failed resuscitation. Autopsy procedures demanded stricter confirmation tests. Doctors whispered about the Alvarez clause. Never assume silence means the end. His survival wasn't just personal transformation, it was institutional. A reminder carved not in textbooks, but in human flesh and breath. Alvarez's case wasn't just a survival story. It was a confrontation with the limits of certainty. Science declared him dead. Protocol sealed his fate, yet his body defied both, whispering through eyelid flickers and shallow breaths until someone chose to listen. His journey from the autopsy table back to life is a haunting reminder that medicine is powerful, but not infallible. Beyond the clinical miracle lies the human lesson. For his family, every heartbeat is no longer taken for granted. For the doctors, humility became as vital as skill. And for Alvarez himself, life became something borrowed, a second chance to be guarded fiercely. Stories like his blur the line between biology and fate, forcing us to ask, was it science or something beyond that saved him? And so, we leave you with a question. What do you think really saved this patient's life? Science or fate? Share your thoughts in the comments below, and don't miss our next shocking medical mystery, the patient whose laughter nearly became deadly.